Which diagnostic test would be most useful to confirm this diagnosis? Okay, so 4-year-old girl, she's brought to the pediatrician by her parents who are concerned about her poor weight gain, abnormal hair growth. They mentioned that her hair is sparse, brittle, and lighter in color than expected. The infant has a history of recurrent infections and delayed developmental milestones. It's hypotonic, joint hypermobility, and low-pitched cry. Laboratory tests reveal low serum copper and ceruloplasmin levels. Pediatrician suspects a disorder involving copper metabolism. The following diagnostic tests would be the most useful. I mean, I don't think this is Wilson disease, right? Because Wilson's is like, because initially when they said copper, I was like, okay, maybe that's true, but I think Wilson disease presents with increased copper, but like decreased ceruloplasmin. Um, and then I know like in Wilson disease, you get like hepatic symptoms, neurologic symptoms, eye symptoms like Lish nodules, but I can't remember anything about sparse, brittle, or lighter hair than expected, things like that. Um, the recurrent infections. I mean, initially when I was like, okay, 4-month-old girl with recurrent infections and failure to thrive, I'm like, SCID, right? I mean, you would confirm SCID by trying to see like measure their like immunoglobulin levels, or I guess you could do a genetic testing too, like for like adenosine deaminase deficiency. So I guess I'll go with that. I mean, I don't know what the copper stuff is.
Okay. So yeah, so this is kind of a rare recessive copper metabolism, Menkes disease, right? That's how you get all the what is it called? What are those collagen connection stuff, right? If I'm not mistaken, right? Menkes disease is a old kind of disease in step one that they like to test over, where you have brittle hair, brittle fingernails, things like that. But it's just practically like if you don't have copper, or you can't create, absorb copper, and you can't use copper, then that is a lot of building blocks with collagen, and collagen's in everything, right? And so the best thing you can do, even if you didn't know the diagnosis here, like you're saying, right, you're thinking that this is some kind of syndrome, you know what I mean? Like this is some kind of genetic issue that's causing, whole sorts of issues. So your best answer here is going to be genetic testing, even if you didn't know it was Menkes disease.
Well,
But
it
yeah,
says it's rare X-linked recessive. And it's a
yep,
girl.
yeah, that's true. Yeah, I don't know. It shouldn't be in a girl. It should be a boy, like you said. But I should probably fix that. This needs to be a boy. But does it make sense? What I'm trying to say, when you're working through this, you're thinking that it has to be, um, there has to be, what is it called? It has to be kind of some kind of syndrome. So
Makes sense.